What's up, everyone? Welcome back to For the Love of Surgery Textbook Edition.
I'm the greatest in the game. Everybody knows my name. Put your hands in the air, fellas. And all the ladies do the same.
In this video, we're diving into Chapter 3 of Surgical Technology for the Surgical Technologist, the Surgical Patient. Today, we're putting the spotlight where it belongs, on the patient. Not the procedure, not the technology, but the human being at the center of it all. Because no matter how advanced our tools become, the heart of surgical care will always be the person on the table. So let's just explore how surgical technologists meet not just the physical, but also the emotional, cultural, and spiritual needs of our patients, starting with your care and their role. As a surgical technologist, your interaction with the patient might be brief, but it is powerful. From the moment the patient enters the operating room, they're relying on you to protect them. You're responsible for ensuring the highest standard of aseptic technique, creating a sterile, safe environment where infection and error are minimized. But it's way more than just technical skill. It is trust, it's compassion. Even if the patient is under anesthesia, your presence, your focus, and your respect for them still matter deeply. Let's talk about what patients actually need and how we prioritize those needs. We use Maslow's hierarchy of needs to understand this. It's a pyramid with 5 levels, each representing a layer of human necessity. Physical needs, which include breathing, circulation, warmth, nutrition, your patient's most basic survival needs. These are your top priority in surgery. Then you have your safety needs, ensuring the environment is sterile, the equipment functions properly, and the patient is secure under anesthesia. Next is love and belonging. Surgery is very isolating. A simple, comforting tone of a voice can make a nervous patient feel seen and cared for. Next, esteem needs. Dignity does matter. From draping to language, everything should be respectful. And 5, self-actualization. This level reminds us that our patients are whole people with goals, dreams, and lives outside of the operating room. By understanding these levels, we become more than just technologists or technicians. We become true caregivers. As we know, every patient brings with them unique cultural backgrounds and often religious beliefs that shape how they experience illness and surgery. Some may request prayer before surgery, others might have concerns about blood transfusions, dietary restrictions, modesty, or gender-based provider preferences. The keys here, respect and awareness. You want to make sure you always listen, never assume, and when in doubt, ask or advocate on the patient's behalf. Being culturally sensitive isn't just ethical, it's essential for building trust and delivering effective care. Our surgical patients are dealing with more than just the physical discomfort. They're experiencing emotional and social stress and sometimes spiritual uncertainties. So let's break down their different needs. Their physical need, which is pain control, warmth, oxygenation, these are immediate. Then you have your psychological needs. Anxiety, fear of the unknown, or even fear of death. Even a small word of reassurance can help ease their mind. Then we have social needs. Being separated from a loved one during a very vulnerable moment can be distressing. Then we have spiritual needs. Some patients may find strength in faith. Others may question everything. Either way, they deserve respect and your empathy. You must understand people respond differently to illnesses and hospitalization. Some are calm. Others may be in denial, angry, or even withdrawn. And every single emotion or reaction is valid. As a surgical technologist, our role is not to fix emotions, but to respond to them with empathy. And of course, sometimes the outcome isn't survival. Patients may die in the operating room. And when this happens, the surgical team follows a very specific protocol. Handling the body with dignity, preserving medical records, and supporting the family with compassion. Understanding this process prepares you not just technically, but also emotionally for one of the hardest realities in healthcare. So you're looking out for the patient, but also understanding your role in it all. So what did we learn today? Every single surgical patient is a complex whole person, not just a case. Your role as a tech includes compassion, cultural awareness, and emotional intelligence. You want to meet the basic needs first, but never forget the emotional and spiritual ones. And above all, treat every patient with the same care and dignity you'd want someone to treat you with. If you're following along with me on this series, make sure you like, comment, and subscribe to this channel so that way you don't miss the next chapter, which is Chapter 4, Special Populations, where we'll discover how surgical care changes when the patient is pediatric, geriatric, pregnant, or has special needs. Thank you guys so much for watching. And remember, the best surgical technologists don't just know the procedure, they understand the person and patient on the table. Bye. See you guys in the next video.
I'm the greatest in the game. Everybody knows my name. Put your hands in the air, fellas.